Good afternoon, everyone. Thank you for joining us for this COVID-19 daily brief. Fellow Kenyans, as the coronavirus continues to ravage the globe, there have also been many recoveries. 3 million persons out of the 6.2 million infected globally have fully recovered. These recoveries are attributed to the diligent and committed work of healthcare workers operating in enabled health systems. In our country, I am delighted to inform you that today we have discharged 54 patients who have recovered from coronavirus disease. This is the highest number of recoveries that we have recorded since we announced the first case of recovery on 1st April 2020. This now brings to 553 the number of individuals who have recovered from the disease in the country. I want to take this opportunity to thank and pay tribute to our healthcare workers for this success. This demonstrates that with good management, this disease, when clinically manifested, is curable and hence not a death sentence. While celebrating this success, I want to reiterate the importance of observing the containment measures. You will agree with me that over the last several weeks or so, even as you are going about your business within the city of Nairobi, you get the feeling that things are coming back to normal. It is as if people have abandoned the caution that we have been preaching and are beginning to move around as though business is normal. A casual walk down the streets of the CBD of Nairobi is very revealing. You will notice quite a number of people who may not be wearing masks. And if they are wearing masks, they are not wearing masks properly. I often see people using masks as a chin guard. The mask is not a chin guard. The mask must be worn properly. We notice people who wear the mask and just cover the mouth. It defeats the purpose. The mask must be properly worn to cover both the nose and the mouth so as to effectively do its job of protecting you and protecting others. We must wear masks at all times to protect ourselves and our loved ones and avoid the risk of being infected or infecting others. We have said repeatedly here, it's important. Kenyans must take the responsibility. They must take the responsibility of taking care of themselves and those around them. It is also now common knowledge that many entertainment joints have opened up for full business. As I said earlier, as you walk around, you get the feeling that people are either anticipating that there is going to be a relaxation of the measures that have been put in place and have moved ahead of that expectation by actually behaving in that manner that things are back to normal. I want to remind ourselves that the only measure that has been relaxed is the measure that allowed operation of restaurants and eateries, again based on strict adherence to the social and physical distancing measures. That is the only thing that has been relaxed, and even that on the condition that social and physical distancing is observed, but also that the workers within these establishments are able to demonstrate that they are negative, COVID negative. The curfew has not been relaxed. The restricted movements have not been relaxed. The ban of gatherings has not been relaxed. Yet we are beginning to see that people are now flouting these rules. I'm sure that you have seen some video clips in the social media showing people crowding entertainment spots and throwing all caution to the wind as regards social distancing. This is flirting with danger. It creates the perfect environment for infection. We must not allow ourselves to quickly recede to the old ways. By and large, a large number of our population are adhering to these measures. And we want to appeal to the entire population to adhere to these measures until such time that some relief is announced. Yesterday, I informed you about what is expected of our cross-border truck drivers before they start their journey. There is some level of concern that there is now a build-up of congestion of truck drivers at some of the border points. And this is because most of these drivers are not observing the protocols that have been put in place. That is obtaining a COVID-19 free certificate before departing on their journey, 48 hours prior to departing on their journey. Because of this, that they are not observing this requirement and traveling with their cargo to the border points, this creates a problem and a snarl up at the border points where now sample collection and waiting of results now creates this type of congestion which we see at the borders. Therefore, again, we appeal to truck drivers, their employers, to ensure that these truck drivers, as they undertake these journeys, only do so upon having with them a COVID-19 free certificate. Let me now move to the statistics of the day. Today, we report the testing of 2,112 samples, of which 123 turned positive over the last 24 hours. The total number of confirmed or positive cases we have in the country is now at 2,216. And the number of samples that we have tested so far is 85,058. These positive cases are from the following counties: Nairobi, 44, Mombasa, 34, Busia, 20, Uasin Gishu, 12, Kiambu, 3, Kajiado, 3, Nyeri, 3, Kilifi, 2, Garissa, 1, and Laikipia, 1. Distribution of the cases in the sub-counties within these counties is as follows. The 44 cases in Nairobi are from Kibra, 10, Westlands 9, Dagoretti 4, Embakasi West 4, Embakasi South 3, Langata 3, Makadara 3, Mathare 3, Kasarani 3, Ruaraka and Kamkunji 1 each. In Mombasa, the 34 cases are from Mvita 11, Jomvu 8, Changamwe 5, Likoni 4, Kisauni and Nyali 3 each. That's it for Mombasa. The 20 cases in Busia are all truck drivers at the Malaba border point, while the 12 cases in Uasin Gishu are also of truck drivers at Tarbo. Similarly, the 3 cases in Kajiado are all truck drivers. In Nyeri, the 3 cases are from Nyeri Central 2 and Nyeri South 1. In Garissa, the 1 case is from Garissa Town, and in Laikipia, the 1 case is from Laikipia West. 90 of the 123 positive cases over the last 24 hours are male, and 33 are female. The youngest is 8 years old, and the oldest is 84 years old. We have also sadly lost 3 patients from COVID-19, all of whom are males. 2 of them are from Nairobi, while 1 is from Nyeri. The youngest one is 12-year-old boy who tested positive posthumously, while the other 2 are 41 years and 71 years of age, respectively. Our heartfelt condolences to their families and friends. This now brings to 74 the total number of those who have succumbed to COVID-19 disease. In conclusion, allow me to once again thank our healthcare workers for the wonderful work they continue to do that has seen the many recoveries that we have registered today. I also want to thank members of the media for your commitment and dedication and interest in delivering the messages of COVID-19 response to the Kenyan public. You have walked together with us in this journey since it started. We value your support. I thank you.
My name is Chemutai going from Citizen TV, and I have 2 quick questions. What is the actual status of the backlog in terms of samples that have been collected? How many, the processing and those that results are yet to be relayed? And how many reagents do you have? How many are you expecting? And is it true that there are a number of samples that have been lost and people have been asked to have their samples taken afresh to be retested? Thank you.
My name is David Mudoka from TV47. My question touches on our correctional facilities. What is the status of the targeted mass testing within our prisons?
Nancy Okware kutoka KBC. Imekuwa takriban wiki 2 tangu mlipotangaza visa viwili vya corona katika kambi ya wakimbizi kule Dadaab, na hususan katika eneo la Ifo na Dagahale. Je, kufikia sasa mmejaribu ama mmefanya nini ili kuwapata wale ambao walitangamana na waliopatikana kuwa na virusi vya corona, na vile vile ni kipi ambacho mnafanya ikizingatiwa kwamba kuna idadi kubwa ya watu pale, hivyo basi hatari ya msambao zaidi? Na mwisho kabisa, Isli kumekuwa kwamba hatupati visa katika siku za hivi karibuni. Ni kumaanisha kwamba hali pale imekuwa shwari ama ni vipi?
Naitwa Haemba kutoka Ebru TV. Nilikuwa naomba tu kujua iwapo serikali kufikia sasa ni watu wangapi wangali katika karantini.
Okay. Thank you. Chemtai Goin, citizen. I take this opportunity to congratulate you on the commendation that you received. I think it was you and Purity. Congratulations on that. The backlog of samples. I don't know whether I can give you exact figures on what the backlog is, but a backlog is common when you are doing expanded level of testing. It is natural, it happens, but the aim is to try to cut down that backlog as much as possible. Sometimes this backlog may be created not only by the sheer numbers of samples that you are collecting, but by other issues such as the logistics of moving those samples to different places, or the lack of reagents to be able to cope with the number of samples. I can assure you that we are addressing this backlog because the aim is not to keep people awaiting for results or holding them in quarantine or largely in quarantine, or truck drivers waiting along the borders because the test results have not come in. So we do prioritize also in terms of testing on those areas where we feel it is very critical that these results are returned quickly. And we apply those resources according to those priorities as we work through the backlog. So in terms of backlog, yes, it happens, and we might experience various levels of backlog depending on where we are in terms of our supply chain. And right now we have seen that we have a bit of a backlog, but we are working on trying to clear that. Samples, reagent levels, I think I have addressed that. Samples lost and the need to resample people from whom these samples were collected. I am not aware of any samples that we have misplaced or lost. I think, as I said earlier, in a situation like this, what might happen is that the logistics of moving samples, because remember these samples are coming from all parts of the country. Some of them are coming to a central point, most of them to Nairobi, where we have the high throughput systems that we use. So it might take a while before those samples are actually received in the labs. And I don't think that we have a problem in that area. David Mutoka, the prisons. What's happening at the prisons? I think it was last week that we reported here targeted testing that we conducted, particularly in Nairobi Remand Prison, because that was the first time we had recorded 2 positive cases there, subsequent to which we worked with the correctional department to isolate the infected persons, and then we went back to check that community to see what the level of transmission was. Indeed, we did find quite a number. I think it was around 40 or so, who are now also been isolated, and the necessary measures are being taken. We are working closely with the correctional facilities to address the issue of prisons because of the very nature that prisons tend to be congested areas. The good thing with prisons, though, is that they are closed communities. So the aim really is to try to keep it closed so that externally they do not get infection from people who are coming from the general population. That is the strategy that we are pursuing with the correctional facility. Nancy KBC, you wanted to know about Dadaab, the refugee camps. Indeed, you are right. I think we did report a few cases from the camps in Dadaab, Ifo and Dagahale. What happens once we receive contact in any place, once we receive a positive in any place, immediately the rapid response teams swing into action to begin to now do the contact tracing. And that is a standard procedure. So whoever that these positive cases may have come into contact with are being followed up on. How far we have reached in terms of that contact tracing, perhaps we'll try to get you that information, specific information, and give it to you when we have it. Then there was a question about Eastleigh and what is happening in Eastleigh, and is it time to do something about the restricted movement in Eastleigh, and the other place was Old Town Mombasa. I can say that the figures we are looking at now as we continue to focus on some of these areas are a little bit encouraging in the sense that we are not seeing the levels that we had seen earlier. But in terms of whether these measures and when these measures will be changed either way, I think let us wait and see what the pronouncement will be. I know everybody is waiting for June 6th because that is the deadline that was set for the curfew and other measures. So let's wait and see. But the decisions will generally be will be informed by what we are seeing in terms of transmission levels within those places. Khaemba, how many people are in quarantine? Kefa Ombacho, maybe you can respond to that one.
Okay. Thank you so much, Waziri. Kas. As you are aware, the ministry and the government has since shifted the issues of quarantine, and this has gone up to the counties. As you are aware, the issues of quarantining is changing every day because the enforcement is being done by all relevant counties. Basically, in this question which you have asked, we can only give you the status maybe tomorrow for the today because we have got to get the information, the current status in all the counties, because each county is doing its own enforcement based on the identified quarantine facilities in their counties. And the information is supposed to be flowing to the central for us to be able to be having at the end of the month how many quarantine persons were there and how many have been released. That is the status.
Okay. Let me just make another comment about the truck drivers and the need for us to keep that northern corridor flowing seamlessly so that traffic does not congest and cause a snarl up, particularly at the border points of Malaba and Busia. You will notice that in the figures that we give you, we provide information as to where truck drivers are being sampled and turning positive. One of those places is Turbo. It's a sample collection point at Turbo for truck drivers. Those samples can be analyzed quickly in Eldoret and returned very fast so that the truck drivers do not have to then go and congest the border point. I also want to inform you that we have also activated and operationalized 2 mobile laboratories. One is already functional in Namanga and is doing the testing in Namanga, mainly of truck drivers. And the other one is also operational now in Mai Mahiu in Naivasha. These labs, again, are largely going to be able to serve the truckers so that we, by providing these sample collection and testing points along that corridor, is a way in which we want to be able to ensure that truckers are able to get those certificates before they proceed to a border point for crossing the border into another country. Thank you.